Law that as soon as you would start something, it would go wrong.
Oh, I think we're good. Yes. Awesome. Thank you, Harrison. Let's give it up for Harrison. All right. Well, thank you guys so much for being here this evening. Thank you for those that are watching online. My name is Jessie Rogers. I am the Prevention Program Director at Rim Family Services. And tonight we just wanted to provide some education for the community at large, for parents, and so hopefully there's more that are watching online. And we're going to be posting this on our Rim Family Services YouTube channel after tonight so that you can rewatch it as well, so it'll be available later. And so we also wanted to just highlight, we are right in the middle of National Prevention Week. That's put on by SAMHSA, which is the Substance Abuse and Mental Health Services Administration. The theme this year, they're kind of doing My Prevention Story. And so what is it in your life that kind of keeps you from, kind of staying above the influence of drugs or alcohol? And especially within our youth, and that's what we focus on, is trying to prevent underage access and use of different substances. And so tonight we have a panel of some amazing people that are going to be talking mainly about fentanyl and current drug trends within our community. And so I don't want to waste any more time. And we do have pizza coming. I did a little mishap and decided to order it for tomorrow. So if you guys want to come back tomorrow, there might be pizza here too. But we reordered it for tonight, and so we'll have that at least by the time you guys leave. So for those of you watching online, you still have time to come down and get food. So with that, I'm going to pass the mic over to Regina Brown.
Hello. I want to thank everyone for coming to this event because it's very important and personal to my heart because of my story. And it all has to start somewhere. I didn't know anything about fentanyl and those dangerous things that are going on out there with it until I had to encounter it through my son. My son's name is Daunte Symonette, and in these pictures you can see he was a very normal child. He was well involved with church and scouts and sports and was very loved by so many in this community. Once COVID hit, things got really tough. He could not learn through the computer, and he started rebelling and taking off and trying to find himself. And he found himself at the skate park a lot because he loved skateboarding. And that was what he found was his most joy in life, was just skateboarding, learning as much tricks as he could, getting on the Instagram and YouTube and getting a ton of followers, and he was really good. I was very proud of him, but we all know that there's also other dangers out there, and I'll just be honest with you right now. When I was a teenage kid, I explored things too, but those things didn't kill me. They weren't like it is today. It's very different. And my son was approached by a kid, and he offered him a Percocet. And a Percocet is a pain pill. It's a prescription for a pain pill. And my son said, "Oh, really? You know, this will kind of give me a cool buzz?" And he said, "Yeah." So my son took it, and he was like, "Wow, I really liked it." So he went back to the skate park, and he found that kid again another day and asked him if he had another one. And the kid said, "Yeah, I did, one for $10. And so my son took it and gave him the $10. And that particular weekend, I was gone with my husband and a bunch of friends out deep sea fishing, just trying to enjoy a little bit of life from COVID. And I had my older son, my 29-year-old, stay at my house and watch my 13-year-old and my 16-year-old son. Well, my son came home that night and he forgot my oldest son was going to be there, so he was really excited. And he seemed totally normal. Gave him hugs, ate dinner, did everything like a normal child would. And then a short while later, he decided he was going to go to his room and go to bed. And so he said goodnight and gave hugs and I love yous and went to his room. In the middle of the night, my 13-year-old daughter had heard some strange noises. So she came walking up the stairs and realized it was my son, who was just snoring really loud, much more than the normal. But it was just a snore, she thought, which wasn't just more than a snore. It's the actual sign of when somebody is overdosing. And she went back to her room. And the next day, my oldest son and my youngest daughter woke up and were watching TV. And about 11 o'clock in the morning, my son's girlfriend called my daughter and said, "Can you please go and wake up Daunte? He's gonna be late for work." And she went into the room and found him completely unresponsive. And she ran out of the room screaming for her older brother, Joe, Daunte's dead. And he ran into the bedroom and started tapping him on the face and
splashing water on his face and checked for his pulse. And while he was doing that, my daughter called me. I had just gotten off the ship and she told me, and I just started screaming, "Get him to the hospital. Just get him to the hospital." I didn't know what was wrong with him, but just get him to the hospital. And they did. They just snatched him up and raced him to the hospital. And then I've been up here over 27 years. I've done so many things in our community, and everybody at the hospital knows me. My mom lived there from the time she was 48 to 61 with MS, and so they all knew me. They all knew my kids. And she goes over to the phone and she just calls me. She's like, "Regina, you gotta come now. Like, we're saving him, and then we're losing him. And then we're saving him, and we're losing him. You've got to come now." And I was like, "No problem, I'm on my way." Well, during that time that I had to run back to the hotel, pack up all my stuff, and get out here to the hospital, they had contacted Loma Linda ICU pediatrics doctor, and they flew up here to the mountains, and he managed to stabilize my son and flew him back down to Loma Linda, where he stayed for 6 days with 24-hour doctor care around the clock until the 5th day, when they got all the test results in. And they said that his brain did not have enough oxygen for too long, that he's never going to come out of this. And I said, "Well, when do I get to make the decision here then?" And they're like, "It's up to you right now." So because I wouldn't want to live this way, and I wouldn't want him to live this way. So we pulled him off of life support. And 8 hours later, he had passed. He took his last breath in my arms. And this sign means a lot to me because this was my skater boy, and it was my 13-year-old daughter who had found him. And that was his last breath. And there's something really important that I want everybody to know. We found a baggie with just half of that pill on the floor in his bedroom. It was not even what he thought was it wasn't a whole Percocet, it was just half a pill. And that's all it took to kill him, was half a pill. And it can happen to anybody. I know there's a lot of people out there that have explored when they were younger, and our kids at this day and age are still doing it, but it's not safe. We have got to pass this word around and save our children. And the only way to do it is by holding events as much as we can to share that awareness so that nobody else has to go through this. I had a skate event for my son, and it was really special to see all the kids come because they knew him so much and they loved him. And I have this poster made so that they can see it, because as you can see on here, it shows the 2 different types of pills. But they look just the same. And it'll fool anybody's children. And these kids are getting it from people that they think are their friends. And if we could just get this message out to everybody and know that a real friend is a friend who's not going to want to reach out and give drugs to anybody this day and age. He was barely 16. He couldn't even finish out high school. He didn't get to be there for my daughter's wedding. He's not going to be there for my 13-year-old's graduation next year. We're missing out on a whole lot every day, all the time, because he's not there with us. And I just hope and pray that everyone can share this as much as they can and save other children, other people. Thank you for listening.
I put together a little presentation. My focus will be on Narcan, which is also called naloxone, but it is a drug that can reverse the effects of opioid overdose. One of the most important things I want you all to take away is that Narcan saves lives.
So while they're getting that together, I did just want to promote, we have a coalition that's called RIM Communities for Youth Coalition. And basically we're just trying to have community members or parents that would like to join us. We meet on the second Tuesday of every month at 12 o'clock online at Zoom. And you can sign up. We'll have a sheet over here in just a minute if you would like to receive emails to be a part of the email list that we send out that remind you of those meetings. We can definitely get you signed up for that. Also, we have surveys over here. So we are funded through the county, and because of that, they like to collect data on what are people's perceptions on what's going on within our community. And so those surveys actually really help us out and help us to continue to get funding and helps guide our campaigns and education and that kind of stuff. So if you have a moment before you leave this evening, you can either scan a QR code, and if you are under 18 or under, you can also do the youth one that has a QR code, and then there's an adult one, or there's paper surveys that you can fill out as well. So we hope that you guys can join the coalition, and kind of helps to kind of take action with what's going on too, be a part of the community. So, and then also get your feedback with those surveys. We really appreciate it. Are we good?
Yeah.
Awesome.
We're actually going to have to skip those. I'm so sorry. A lot of it was just about, it shows the trends of when the opioid epidemic came and how quickly it surpassed every other cause of death in the United States. And when it was around 80, close to late 80s, it just skyrocketed. The second video was a short video that just kind of showed when the epidemic first started, it was the pain medications. And that was a lot of doctors and everything. It was actually pushed, but a lot of doctors would just send out prescriptions of these pain killers, and adults, kids, everything would get hooked without really even knowing. But due to the cost of pain medications, or when the prescriptions ran out, because at a certain point, the government really cracked down on writing all these scripts. So at that point, they had to look for other avenues to obtain their opioid. A lot of them turned to the streets to buy pain medications, but that was very expensive. So a lot then turned to heroin, which was a lot cheaper and a lot less. You only had to use a little bit to get the same amount of high. this actually shows the difference when you're talking about an overdose. As you can see, the amount of heroin needed versus fentanyl versus a new drug that would be coming out, the carfentanyl, but it's alarming. So people that were on heroin and continue to use, when things began to be covered with fentanyl or just added a little bit of fentanyl because it made the high cheaper, they didn't know what they were getting or how to kind of leverage that. And it started a huge overdose. At Mountains Community, we partnered with California Bridge, which is an organization that went through the state of California, partnering with a lot of hospitals, trying to get subscription Suboxone and treatment program, medication-assisted treatment programs into the hospitals so that patients could get off of fentanyl, heroin, etc. That we could meet the patients where they were. So we started that about a year ago, and I will say the culture was kind of like hushed. It wasn't really talked about. Even when people would come in on a opioid or substance use, I'm the social worker there, and I never really received consults. It was more looking at the person. There was definitely a different culture when this first started, as looking at people that used as dirty or what's wrong with them or not being clean or criminals, etc. But the more education that surrounded this about it being a disease and needing help, the more that culture started shifting. And I began getting consults weekly and then daily. And it was something that the nurses wanted education on, and it began being talked about. And that's one of the things is information and education is what helps treat and prevent. Up here on the mountain, one of the things that I run into, which is one of the biggest issues, is having a clinic that can subscribe or prescribe substance or medication-assisted treatments. We do not have any doctor up here on the mountain that will write for Suboxone currently. Our ER doesn't, but they do not do it on a continuous basis. So if somebody comes into the ER, they're close to overdosing or they're in withdrawal or etc., or they're just wanting to get off of opioids, we can write it, but then I help set them up on a clinic. There are, due to COVID, there is a lot of telehealth providers now, which is wonderful. However, IHP is one of our biggest insurance providers on the mountain, and none of these telehealth providers are in network with IHP. At one of the last California Hospital Association conferences, I did speak with a IHP representative and just told them how much of a problem this was, because when you're talking about wintertime or getting down the mountain and back up, that's an hour. And these clinics, most of them, require weekly visits in order for them to come down, do a drug test, check in, etc., then get their prescription. And then a lot of our substance use, our patients with substance use, they don't have access to a car or transportation. There's just so many barriers that come in. Sykes in San Bernardino is one of the facilities that has worked with us and helping make it every other week, which is a start until we find a different avenue to help up here. But one of the things that I was most proud of is our rollout of Narcan. And everyone should carry Narcan. It's not if you use, it's not if you know someone that uses, it's if you are a human being and you go out into the world. I was driving around, and this was before I had access to Narcan. I was driving around, and I was in Ukaipa actually in downtown, and somebody was passed out. I'm not 100% certain that it was an overdose, but that's what it appeared to me. but I didn't have any Narcan. So you never know when you may be in a situation to need it. One of the things that I always say is Narcan saves lives. If you give it to someone that you feel they're in an overdose, it reverses the effect of opioid. If they are not in an overdose and you give it to them, there is no harm caused. But you may save a life. So you can come to the hospital, no questions asked, no ID required. You don't have to give your name, you don't have to be a patient, you don't have to check in, you don't have to have a prescription. You come up to the window, say, I need Narcan, and we will give you Narcan. It is carried in our emergency room, our med surge, our surgery, all departments mostly carry it. I can be called to give it out. We want anyone and everyone to have some. There's boxes over here actually on the table. There's a QR code on the box. It's a 30-second video, which is what this is, and it shows you how to use the Narcan. There's also a flap on the front of the box. It's 1, 2, 3 steps. It's like a little nose spray. It actually just, you put your 2 fingers and your thumb on it, spray. There's 2 Narcans in each box. This is, you try to wake the person up, call 911, you administer, check for breathing, and you stay with the person. As easy as that. And just remember, Narcan does save lives. Well, fentanyl is a prescription, yes, it can be. It's used for pain, and a lot of serious life-threatening diseases can be prescribed depending on. But that was a fake Percocet, which is just a pill. That was a pain medication, but somebody had swapped it out. But fentanyl is prescribed and can be prescribed, yes. But it was to be passed as a Percocet, which is it's a pain medication that was given out greatly during the epidemic, and they would just pass them out. But now it's easily found on the street. It alone would not create an overdose, but this was fentanyl passed as Percocet.
All right, so good afternoon. My name is Deputy Romero. I'm with the San Bernardino County Sheriff's Department assigned to the Twin Peaks Station. I'm going to be showing you guys a few photographs of some of the drugs we've seized. First, I want to thank you guys for being here. Thank everyone who's watching us online, and thank you for the organizers for setting this up and inviting us. And then, so I'm here as well as my partner, Deputy Snow. He's in the back, and then we have some of our explorers here with us as well. So if you guys have any questions at the end, we can answer those for you too, okay? So a lot of the photographs I'm going to show you, these narcotics were seized during either search warrants or traffic stops. We're not going to go into too much detail about how they were obtained due to them being part of ongoing investigations or court proceedings still pending. But again, if you guys have any questions, we'll try to answer those. So the first picture there on the left, that's going to be, those are going to be fake Xanax bars. So they're made to look like actual prescribed drugs, but it's actually fentanyl. So that's just kind of what they look like there. They try to make them look very similar, but again, it's missing markings and other things like that. So those are fake pills. On the right-hand side there, you have multiple little plastic baggies which contain a white powdery substance, which is actually fentanyl. So in the previous PowerPoint meeting, we were shown how much fentanyl it actually takes for you to overdose, and most of those baggies have maybe 2 or 3 times what the deadly amount would be. So So these are more of the narcotics we've encountered. Just keep in mind, these are just some of the ones I've encountered over the last few months. You have to think about all the other deputies that work up here, all the CHP officers that work up here, and all the other investigators that are up here from different agencies. So just so you guys have a picture of how many drugs we actually come in contact with. So there on the left-hand side, there's about 3 pounds of methamphetamine there. On the right top side, you have a smaller Ziploc baggie. That contained about an ounce of fentanyl. And on the right-hand side, you have about a 1/4 pound of methamphetamine. So here, we have another white powdery substance. So this is where it gets difficult trying to figure out what kind of drugs we have in our possession. So sometimes cocaine can look very similar to fentanyl. So here we have small baggies. They all contain suspected cocaine. And then on the right-hand side there, we have some psychedelic mushrooms and marijuana. If you guys, for whatever reason, ever encounter something that you believe could be narcotics, I would say just protect yourself. Maybe put in a call for service, grab some gloves, a paper bag, plastic bag. That way you're able to grab that item, and so you don't expose yourself. Just to give you guys a little story, one of our detectives at our station, he was serving a search warrant, opened a container, what he believed to be protein powder, just to check the contents of it. Some of the dust actually kicked up, which caused him to overdose. At that time, our department had not issued our personnel Narcan. Luckily, one of the probation officers that was there did have Narcan and was able to save his life. Our department has now issued Narcan to all our patrol deputies, so we all carry it with us. We carry 2 little containers, which is 2 doses of Narcan, so we'll have that while we're out on patrol. So for us, a lot of times when we do come across these narcotics, it's either from us being proactive or calls for service. That's not going to help us get all of the drugs that are actually up here on the mountain. A lot of times we need help from the public. I know there's a stigma with calling law enforcement and giving us a heads up of what's going on in the community, but it's important for us because we hear it all the time that we're not doing anything or we're not helping, but we can't be everywhere at all times, and we don't know everything that's going on. So it's important for us to do our part, but in order for us to do that, we need help from the public. And this is one way you can do it and remain anonymous. It's go on the lead tip line, so you can either call or you can go online. So this is my work number here, if you guys want to take it down. If you want to share with anyone that might have information that can help us, or just call the station. All the deputies, all the detectives, all the sergeants, everyone there is more than willing to go out there and try to seize these drugs to prevent them from getting into the hands of someone that might overdose. So again, thank you guys for the opportunity, and if you guys have any questions, we'll answer all those at the end, okay?
Hi everybody, my name is Corrine Mora and I'm a field representative for our Congressman Jay Obernolte. I just kind of to answer your question, sir, there are 2 types of fentanyl. This is a pharmaceutical drug that doctors do utilize and prescribe to patients who need it. And then there's also the manufactured fentanyl, which is typically manufactured the illegal way, sold on the streets through drugs, lacing it or making it look like other things. So there are 2 different types here. So let me give you some statistics that I have. Let's see. For the fiscal year of 2023, Customs and Border Protection seized a shocking 27,022 pounds of illicit fentanyl in 2023. That is enough fentanyl to kill every American a dozen times over. As you saw in the picture displayed before, a very small fraction amount of fentanyl can really harm you or kill you. That's about a 286% increase in fentanyl seized at the southern border over the past 2 years, and these numbers are considered to increase throughout time. It has 14,000 overdose deaths in California in 2022, and was found present in 80% of all drugs, illegal substances sold on the streets. The county of San Bernardino has seen a 656% increase in fentanyl-related deaths in San Bernardino County from 2018 to 2021. The San Bernardino County Sheriff's Gangs and Narcotics Division investigators recovered approximately 2,035 pounds, or 9,157,500 pills of fentanyl between 2021 and 2023. In that same period, the San Bernardino County Sheriff's Department Overdose Response Team has conducted 360 fentanyl-related overdose death investigations in the county, and the Coroner's Division reported roughly 930 fentanyl-related overdose deaths, which 263 were just in 2023 alone. So as we can see throughout these recent years, this has increasingly become an extraordinary crisis, which is why we're thankful for groups like this, where we can talk about it, answer questions from multiple people, because it is important to talk about it, especially with your children. So Congressman Obernolte takes these facts and these statistics from the departments and everyone else, and he goes back to Washington, D.C., and this is where he implements legislation and how he proactively tries to protect our community. Since a lot of the fentanyl is coming over the southern border, he does believe that having a stronger border security is really important, because a lot of people, when they come over, are coming over through the cartel, and they're having to bring drugs over, and that's how they're getting over here illegally. So he does feel like we need to increase our border security to help protect the Americans and all of our citizens and constituents here in the community. Congressman Obernolte likes to give our law enforcement officers the tools that they need to be able to fight these challenges. So part of the things that he has done to help with the legislation is he wrote a few letters. So the first one is Congressman Obernolte has wrote a letter to Homeland Security Subcommittee requesting funding for non-intrusive inspection scanner equipment and to prioritize hiring CPD agents who are trained to operate this technology. This would help them inspect cargo that is coming over better to be able to help mitigate some of the fentanyl coming over illegally. He's also wrote a letter to the Homeland Security Subcommittee to support $60 million for Anduril surveillance towers and to proactively monitor the border and report back any movement without actual people having to do that, so that these towers would be able to do that, and then they can direct people there when they see movement happening. The Congressman has also sent a letter to the administration regarding the development of the Office of National Drug Control Policy, the 2024 National Drug Control Strategy. So what he did in that was requested that they utilize whatever authority is available to address these growing drug crises in the communities across the country, including prosecuting these criminals to the fullest extent allowable under the law, and permanently changing the classification of fentanyl and its analogs to Schedule 1. Decisive action is needed now, and every day that these criminals continue to operate hurts our constituents and our nation as a whole. The Congressman has also co-sponsored several bills, including the Halt Fentanyl Act, which would permanently change the classification of fentanyl to Schedule 1. He is a co-sponsor of that legislation, and that would make the temporary class-wide scheduling order for fentanyl-related substances permanent. He's also a co-sponsor for Securing America's Border Against Fentanyl Act, which would require the administration to develop new strategies to target and detect illicit fentanyl coming through the southern border and onto America's streets. It will more than quadruple research and development into technologies and strategies that deter and interdict fentanyl shipments into the U.S. And then he's also co-sponsored the Felony Murder for Deadly Fentanyl Distribution Act, which would increase the penalty for knowingly distributing fentanyl to reflect the unique lethality of this drug and its potential to kill hundreds of thousands of people across the United States. Felony murder is equivalent to first degree. Premeditated murder requires a minimum sentence of life with eligibility for capital punishment if convicted. So that's saying if a drug dealer knowingly has fentanyl in his drugs and sells it and one person dies, then they can charge him with that higher crime. So those are the legislation that he is trying to move in the House, and that's passing through House, and some of them are pending through the Senate, but that's what he's doing at the federal level to help with legislation, to give our officers the tools that they need, the DA's office the tools that they need to be able to prosecute and try and help prevent these
crimes from continuing to happen. Thank you.
All right, you guys. So in just a minute, we'll have an opportunity for if you guys have any questions that you can ask anyone on the panel. I just wanted to encourage you guys. Well, first off, thank you so much to our panel and those that are here. And just wanted to echo, those numbers that we're hearing about the people that are overdosing just breaks my heart. And I think what's so important is education. My heart hopes that these chairs would have been full tonight. But we do have a resource. We are recording this again. Please pass this along to parents, friends, family, anybody that you know, because if they don't know, how can we help, right? And we have resources at our fingertips here with Narcan that's available to you. Rim Family Services is also a location that distributes Narcan for free. So if you were to come into the agency, you're able to receive some there as well. And we just want to make sure that the world knows the dangers of this drug that's out there, because we want to save our community and our friends and our family. And so with that, I'm going to go ahead and open it up if there are any questions. And again, I'll put this up there so that whoever wants to answer can answer. So, any questions?
Yeah, so our station has put together presentations at high schools and stuff like that, specifically on fentanyl. Our department is very active on social media, constantly posting different things for fentanyl awareness and things of those nature.
And I will say too, like Regina said, just May 4th, I believe it was, she held a community outreach for education purposes, and that was mostly geared towards the youth. It wasn't geared towards adults. I mean, adults should know and should have the education, but it is about reaching the kids. And I think getting out into the community is best. And I know Rim Family has also taken a lot of initiative to get the word out as well.
I personally showed my kids, it's okay, that one. Can you hear me? Yeah. I have a 13-year-old son and a 6-year-old daughter. There's a YouTube video. It's called Dead on Arrival. This was together with the DA's office. And it's a short video, but it really does fit into perspective. And I kind of just share what I can see, visual pictures and videos with my kids. And I have them share it with their friends. And then tell them all the time, not that I think you're going through it, but so you can also share this with other people. So they kind of just don't, you never know. You just have to continue to talk and spread the awareness with them and hope that they'll spread it with their friends too.
That video, Dead on Arrival, is really impactful. I recommend everybody watch it because it really shows the true reality of what's going on out there. And with my son, he was the 6th death in 5 months up here from fentanyl. He was the only child, but that just goes to show that it's hitting our adults mostly, and now it's starting to come down to our children, and it's only going to get worse. So it's up to us to help spread the word to save more people. And if you have somebody who's an addict and they use it and they overdose, then they can do the Narcan and they can save themselves. And we can only hope that eventually they'll realize and get away from it. But when you have somebody who's never done anything ever before and then they try it and they overdose, it's great for them to be able to also be safe, because that could be their eye awakener that this is not something that they want to risk anymore.
I just want to share a personal story from me about this. Be careful in the pharmaceutical arena as well, in the medical field. We need to educate ourselves about fentanyl and so forth, and the unnecessary use of fentanyl and civil procedures. I went in for a pre-op. There was a biopsy on my arm. Simple. You just numb the area and go in, do the biopsy, right? It's just a local, and you're like, well, is anybody with you? No one's with me. Okay, but my daughter's in the lobby, and she goes, well, you'll be in recovery for a while now for a simple biopsy with the numbness to my arm, and so forth and so on. But they recommend they were just going to give me fentanyl, and I declined it. And because I'm educated about the seriousness of fentanyl, I declined it, but they were shocked that I didn't follow the doctor's orders, and they told the doctor she's refusing. It was a simple 2-minute procedure, no pain, it was just a local, and so I think that there's a farmer push as well, because the money maker. So it's not just the boogeyman on the street pushing the drugs, it's also about educating yourself in the medical arena when you're advocating for loved ones and procedures. Ask questions. Educate yourself and ask questions about being your own advocate, but also advocate for your family members and loved ones. Because the farmer push is also there as a money maker. So
I will piggyback on that. That's what started. I mean, it has a very, 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 very huge push when the epidemic started with the pharmaceuticals. Exactly. And that's where a lot of issues begin.
yes.
Any other questions, guys? Well, again, thank you guys so much for being here. If I could just encourage you in one last thing is just, again, try and spread the word as best you can. If you're able to come and be support within the Room Communities for Youth Coalition, please come connect with me. We'll get you signed into our email list. And then if you need any naloxone, we have some over here as well. And thank you so much for coming out. Please grab pizza